Assalamualaikum and good day to all my viewers. Today we'll be detective discovering Warfarin versus Ginseng, the interaction of drugs with foods, including how the food affects the medicine and so on. I'm your detective Yana. This video is for PhD 122 Basic Pharmacology and Pharmacotherapy of the Peripheral Nervous System individual assignment. Let's dive deeper into this topic. To make it simple, pharmacokinetic is what the body does to the drug, categorized by four sections: A, D, M, E: absorption, distribution, metabolism, or you can call it as biotransformation, and excretion. Oh, we have a diagram here, so let's have a quick look. This diagram provides a comprehensive overview of pharmacokinetic food-drug interactions, categorizing them into two main types: specific interactions and unspecific interactions. Okay, we already reached our main focus for this video, the drug-food interaction. It can be defined as a change in the drug's effect on the body when the drug is taken together with certain foods or beverages. So, when drug and food interact with each other, it can have some possible effects, such as decreased action of drugs, increased action of drugs, or cause adverse effects. The coffee may decrease the action of the drugs, the levothyroxine. The coffee may bind to levothyroxine, forming insoluble complexes. It may also accelerate gastric emptying, decreasing the time levothyroxine remains available for absorption. Okay, next. Some foods inhibit enzymes that break down drugs, which can increase drug concentration in the body, which raise both effectiveness and toxicity risks. Like grapefruit juice, it inhibits CYP3A4 enzyme in the intestine, which increase levels of drugs like simvastatin. Warfarin is widely used oral anticoagulant that inhibits vitamin K exposite reductase, reducing synthesis of clotting factors. It has a narrow therapeutic window and is prone to interaction with herbs and supplements, notably ginseng. The first thing here you need to remember that ginseng can affect warfarin metabolism. Ginseng may induce CYP enzymes like CYP2C9, potentially increasing warfarin metabolism and reducing INR. INR stands for International Normalized Ratio. I make you a diagram here so you can understand the warfarin interaction with ginseng better. Okay, so how ginseng affects this pathway? Ginseng may induce CYP enzymes like CYP2C9, CYP3A4, or CYP1A2 depending on the species and dose. This would lead to faster metabolism of warfarin, especially as warfarin, resulting in reduced plasma levels of warfarin, decreased anticoagulant effect, and lower INR values, which can increase the risk of thrombosis. Ginseng does not directly inhibit or activate the vitamin K exposite reductase enzyme. However, by reducing warfarin levels, the inhibition of vitamin K exposite reductase is weakened, which can allow more active vitamin K and activate clotting factors. The interaction of warfarin and ginseng has some side effects, including reduced effectiveness, thromboembolic events, therapeutic failure, and delayed detection. Ginseng may induce CYP2C9 enzyme, increasing metabolism of warfarin, the more active enantiomer, which lead to lower plasma warfarin levels. The decreasing of INR can lead to insufficient anticoagulation, which can increase risk of blood clots, deep vein thrombosis, pulmonary embolism, or stroke. Despite adherence, INR may drop unexpectedly in patients who self-medicate with ginseng, which can lead to treatment failure. Patients and some clinicians may overlook herbal supplement use, delaying identification of cause for INR fluctuation. There's something you need to remember: ginseng does not cause toxicity, but instead blunts warfarin's effect, making it subtherapeutic. Okay, you might be thinking, is this information really happen or is it fake? Okay, let's have a quick look at the journal, the clinical trial. Okay, in the background, people using prescription medication often concurrently take herbal supplements. In the case report, the anticoagulant effect of warfarin decreased after patients consume ginseng. Okay, so this clinical trial designed as randomized, double-blind, and placebo-controlled trial. The participation is 20 healthy patients. The intervention in this 4-week study, 1 month technically, 20 patients received warfarin for 3 days during weeks 1 and 4. Beginning in week 2, patients were assigned to receive either American ginseng or placebo. Placebo technically is like a fake medication that have the same shape of the real ones but have no therapeutic effect or even an effect at all when someone eat it. Okay, so the result, it decreased after 2 weeks of ginseng administration. The INR area under the curve, peak plasma warfarin level, and warfarin AUC were also statistically significantly reduced in the ginseng group as compared with the placebo group. So in conclusion, American ginseng reduced warfarin's anticoagulant effect. When prescribing warfarin, physicians should ask patients about ginseng use. Okay, so as a healthcare provider, You need to remember that patients need to avoid all forms of ginseng while taking warfarin. Check supplement labels carefully for ginseng or herbal blends. Many allergy or immune booster products contain ginseng. Remember that. Patients should not start or stop any supplement or herbal product without first consulting their doctor or pharmacist. Maintain a consistent intake of vitamin K-rich foods such as spinach, kale, broccoli. Do not drastically increase or decrease them without guidance. There are also some alternative drugs that have no effect with ginseng, such as epiceban. It is a direct oral anticoagulant. It less affected by CYP enzyme inducers, no vitamin K interaction. Second, dabigatran. It is direct thrombin inhibitor, which not CYP to C9 dependent. Last, edoxaban, factor XA inhibitor. It is one of the alternative in patients with warfarin ginseng concern. As a healthcare provider, you need to monitor the patient regularly, their INR. Ginseng can reduce INR unexpectedly. Risk of clotting. Ask about all supplements during checkups. Many patients don't realize herbal products can interfere with prescriptions. Watch for signs of under anticoagulation, like leg pain or swelling, chest pain, shortness of breath. This is some symptoms of DVT or PE symptoms. You need to educate on consistent medication timing. Warfarin should be taken at the same time each day, with or without food. You need to encourage use of medication or supplement diary, which helps monitor any new OTC or herbal products. Okay, we already reached the end of our discovery. But the main thing here you need to remember, you can attack warfarin with ginseng. Congratulations, detective! You have successfully analyzed the evidence and identified the key points involved in the mystery of warfarin versus ginseng. The case is now closed. Thank you for joining me. Bye-bye!